Earache home remedy. What causes ear infections? Ear infections are caused by bacteria, viruses, and even fungi getting trapped in the middle or outer ear. Children are more likely to get ear infections than adults. More commonly, a cold, flu, allergies, or smoking may be the catalyst for a middle ear infection. Getting water in your ear canal, as from swimming, may contribute to outer ear infections. Conditions that may increase the risk for ear infections in adults include Type 2 diabetes, eczema, psoriasis, weakened immune system. An earache may be a sign of mild ear infection, and it will usually go away on its own. However, if an earache doesn't go away after 3 days, it's a good idea to see a doctor. This is especially true for children. Whether you're a child or an adult, you should see a doctor if you have ear discharge, fever, loss of balance along with an ear infection. Apple cider vinegar may help mild ear infections of the outer. It has antimicrobial properties, meaning it kills bacteria, fungi, and possibly viruses. Treatment with apple cider vinegar. There are no studies to definitively prove that apple cider vinegar cures ear infections, but it does contain acetic acid. According to a 2013 study, acetic acid is antibacterial, which means it kills bacteria. Another study, trusted source, shows apple cider vinegar can also kill fungi. A third study has shown apple cider vinegar to be effective against bacteria, fungi, and viruses. Apple cider vinegar shouldn't be considered a replacement for a visit with your doctor or traditional treatment for ear infections. It should only be used for outer ear infections. Middle ear infections should be seen and treated by a doctor, especially in children. If you have ear pain and are not sure which type of ear infection is causing it, see your doctor for a diagnosis before putting anything in your ear. Apple cider vinegar with warm water. Ear drops. Mix equal parts apple cider vinegar with warm, not hot, water. Apply 5 to 10 drops in each affected ear using a clean dropper bottle or baby syringe. Cover your ear with a cotton ball or clean cloth and lean on your side to let drops enter and sit in the ear. Do this for about 5 minutes. Repeat this application as often as desired to treat an outer ear infection. Apple cider vinegar with rubbing alcohol. Ear drops. This recipe is identical to the one above except it involves rubbing alcohol instead of warm water. Rubbing alcohol is both antimicrobial and antibacterial. Do not use this method if you have drainage from your ear or think you may have a middle ear infection. Also, do not continue with this mixture if you have any stinging or discomfort when using these drops. Mix equal parts apple cider vinegar with rubbing alcohol, isopropyl alcohol. Apply 5 to 10 drops in each affected ear using a clean dropper bottle or baby syringe. Cover your ear with a cotton ball or clean cloth and lean on your side to let drops enter and sit in the ear. Do this for about 5 minutes. Repeat this application as often as desired to fight ear infection. Apple cider vinegar warm water gargle. Apple cider vinegar can also be gargled to help symptoms that may come along with ear infections. It's not as directly effective as ear drops but might be of extra help, especially for a cold, the flu, and upper respiratory infections. Mix equal parts apple cider vinegar with warm water. Gargle with this solution for about 30 seconds 2 to 3 times per day to help with ear infections or their symptoms. Ear infection symptoms. Ear infection symptoms in children include earache, inflammation, pain and tenderness, fussiness, vomiting, decreased hearing, fever. In adults, symptoms may include earache, inflammation and swelling, pain and tenderness, hearing changes, nausea, vomiting, diarrhea, dizziness, headache, fever. If an earache or infection doesn't go away after 3 days, see a doctor. Always see a doctor if ear discharge, fever, or loss of balance occurs with an ear infection. Alternative treatments. There are other home remedies for ear infections you can try. None of these should replace doctor visits or traditional treatments. They should also only be used for outer ear infections. Middle ear infections should be seen and treated by a doctor. Swimmer's ear drops. Cold or warm compresses. Over-the-counter pain relievers. Tea tree oil, basil oil, garlic oil, eating ginger, hydrogen peroxide. Over-the-counter decongestants and antihistamines. Neti pot, rinse, steam, inhalation. Be aware that the U.S. Food and Drug Administration doesn't regulate essential oils, so be sure to purchase them from a reputable source. Prior to using any essential oil, test a drop or two on a small area of your skin for 24 hours to see if any reaction occurs. Even if the oil does not irritate your skin, it could still cause irritation or discomfort if you put it in your ear. Always follow directions on labels for specific essential oils and keep out of the reach of children. The bottom line: some research supports the use of apple cider vinegar for helping treat outer ear infections at home, but more studies are needed. Apple cider vinegar could be especially helpful for mild outer ear infections when used correctly in children and adults. No home remedy should replace a doctor's recommendations and medications. If ear infections worsen, last for more than 3 days, and are accompanied by fever or other symptoms, stop the use of apple cider vinegar and see your doctor.